Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. The PA profession offers one of the most popular jobs in healthcare, and it's expected to see a 28% increase in employment through 2033, according to the Bureau of Labor Statistics. Today, I'm talking about physician assistants with Robyn Chalupa. She's the chair and program director of Physician Assistant Studies in Upstate's College of Health Professions. Welcome to the Informed Patient, Dr. Chalupa.
Well, thank you.
Let's start, if you don't mind, with a definition of what a physician assistant is and what sorts of things they do on the job.
A physician assistant, or PA, is a medical professional who is licensed, clinically trained, and practices medicine in every medical setting and specialty. PAs diagnose illness, develop and manage treatment plans, prescribe medications, and often serve as a patient's principal healthcare provider. Their specific duties depend on setting, level of experience, specialty, and state law. But generally speaking, PAs can take medical histories, conduct physical exams, diagnose and treat illness, order and interpret tests, prescribe medications, counsel on preventative care, perform procedures, assist in surgery, make rounds in hospitals or nursing homes, or even conduct clinical research.
So it sounds like they're across the board in all areas of medicine.
They are.
So why is this such a popular career right now?
Well, there are several reasons why the PA field is such a popular career right now. First is access and demand. PAs help expand access to healthcare in many settings. Their generalist training means they can flex across different specialties and settings. Second, versatility in team-based care. Because PAs can function in many roles, the profession offers flexibility and many practice options. Third, workforce shortages. The healthcare system is facing shortages of primary care physicians and specialists. PAs help fill those gaps, and so the demand is strong.
So if I understand correctly, they could start out in cardiology and after a few years decide that they want to go into surgery or some other specialty.
And then they could go back again if they wanted to later on in their careers.
Well, what drew you to the profession?
Specifically, my dad was a PA. And so growing up throughout my youth, we would sit around the dinner table and we would hear stories about the things that my dad was experiencing in clinic. He would bring home some different gory things and some simple day-to-day things. He would really share the heart of the profession, which is the patients. And he wouldn't disclose unnecessary details. We were teenagers, probably didn't want to hear it, but he was a great advocate for the profession just at our dinner table. And so I fell in love with what he did, and I wanted to grow up and be a part of patients' lives and be an advocate for patients in the same way he was.
Now, was your dad in the military?
My dad was not in the military.
Okay, because I understood that the birth of the profession comes from the military, right?
It has. So he was definitely a very early person as a civilian. So he went through one of the early training programs and served in an internal medicine role for most of his career before retirement a couple of years ago.
Can you tell us about your military service?
Of course. I began my service in the military as a medical logistics officer. And then rather quickly, because I knew I wanted to be a PA, I applied for the military's physician assistant training program, which is down in San Antonio. And after that, I also knew that I wanted to be an educator. So I kind of had a dual passion from the very beginning. So I went out and I served in aviation medicine up at Fort Drum, New York. And then I've done a lot of PA education through the training program that I went through down in San Antonio.
Now, you also have a doctorate, is that right?
I do. That's right. I hold a doctorate in physician assistant studies, which I earned completing postgraduate training in orthopedics. After becoming a certified PA, I pursued additional advanced training focused on orthopedic medicine and surgery. Many PAs choose to complete postgraduate programs to deepen their expertise in a specialty area, such as surgery, emergency medicine, or psychiatry. Some of those programs are degree granting, like mine was, while others are structured more like residencies or fellowships that focus on intensive hands-on training but don't confer a formal degree. It's also worth noting that PAs earn degrees in a range of academic levels. Most enter practice as a master's degree level, but some go on to earn doctoral degrees in clinical practice, education, or leadership, depending on their professional goals. The profession encourages lifelong learning and adaptability, which is one of the reasons PAs are so effective across different healthcare settings.
Now, let me make sure I have this correct. Your military branch is the Army?
That is correct.
What unique perspective or expertise are you bringing to Upstate in your new role here?
My background combines clinical practice, advanced education, and research. I'm a PA with postgraduate training in orthopedics, and I hold a doctorate in physician assistant studies, as you mentioned. But I also have a Master of Education in Health Professions education degree. I also have extensive experience in clinical research and curriculum development. This combination allows me to support students not only in developing strong clinical skills, but also in understanding evidence-based practice and navigating complex healthcare systems. I bring a perspective that blends hands-on patient care, educational best practices, and research-informed decision-making, which helps prepare future PAs to excel as clinicians and leaders.
What initiatives are you most looking forward to in the PA program?
I am particularly excited about enhancing our clinical training opportunities around the area and integrating more evidence-based hands-on simulation learning. I'm also interested in initiatives that promote interprofessional collaboration and lifelong learning skills, so students are ready not just for today's healthcare environment, but for the evolving challenges of the future.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Robyn Chalupa, the Chair of Physician Assistant Studies at Upstate. What can you tell us about the Physician Assistant program at Upstate? How many students are admitted each year?
Well, just 35 students are selected from hundreds of applicants.
And how long does it take to obtain the PA Master of Science degree?
It typically takes about 27 months to complete. In general, PA master's programs across the country range from 24 to 36 months, depending on the school and whether the program is part-time or full-time. The curriculum combines classroom instruction, laboratory work, and supervised clinical rotations to ensure students are fully prepared for practice.
So beyond an undergraduate degree, what are the other basic requirements to get into the school?
To be admitted into the program at Upstate, like you mentioned, you need an undergraduate degree, but also a strong foundation in the sciences, including biology, chemistry, anatomy, physiology. And also, like most other programs, we require healthcare experience, such as working as a nurse, an EMT, a medical assistant, or volunteer in clinical settings to ensure the applicants understand patient care.
How does the early assurance program work?
This is something I'm super excited about. The early assurance allows motivated students to apply and secure their acceptance into Upstate as a college sophomore. The application process alleviates pressures and expenses associated with applying at more traditional times, as they're a current or rising college senior or as a college graduate. It guarantees admission into Upstate if all the provisions of their acceptance are met by the time they graduate with their bachelor's degree. Early assurance students across other Upstate programs have demonstrated that they are well-rounded individuals and receive great academic success both at their previous institutions and at ours.
So this is for people who really know what they want to do from an early age.
Indeed.
How do you look for applicants in order to tell if they're going to be a good PA when you're looking at an applicant? What are the things that stand out to you?
When evaluating applicants to the PA program, I look closely at how they interact with patients and others. Clinical knowledge and academic success are important, but what really distinguishes a great PA is the ability to connect with people, show empathy, and communicate effectively. These qualities are essential because PAs work closely with patients, families, and the healthcare team. Building trust and understanding often has as much impact on outcomes as medical knowledge. In short, knowledge can be taught and honed, but the ability to form meaningful connections with patients is something that really drives the success of this profession.
Can you describe for us what a clinical rotation is and how that works in with the classroom work?
At Upstate, we have a structure that balances classroom learning with hands-on clinical experience. So the first part of the program, usually about 1 year, focuses on classroom instruction in basic learning and knowledge like anatomy, physiology, pharmacology, and clinical medicine. There's also lab-based skills training. Then they move on to the second part of the program, which emphasizes their clinical rotations. They work in a variety of specialties, and these rotations allow students to apply what they've learned in the classroom to real patient care under supervision. This combination ensures that graduates have both a strong foundation in medical knowledge and extensive practical experience before they enter independent practice.
Do you have a feel for which medical specialties are most attractive to new PAs these days?
It really depends on the student, but everything is open to them. So, our national body says that the surgical subspecialties account for about a quarter of folks who are practicing as PAs. Same for primary care, a little lower. There's a catch all category that's about the same that covers every possible subspecialty that you could imagine. The next biggest one, at about 12.5%, is the internal medicine subspecialties like cardiology or pulmonology. And emergency medicine is about 8%.
So there's another advanced practice provider that sometimes gets confused with physician assistants, and that's the nurse practitioner. How do you describe the difference between NPs and PAs? Because I know some hospitals have both.
Yes, including ours. So, PAs and nurse practitioners are both highly trained healthcare providers, but there are some differences in how they receive their education and their approach to care. So, PAs are trained in the medical model, similar to physicians, which emphasizes disease diagnosis and treatment across multiple body areas. PA programs are generally graduate level with broad training in medicine, surgery, clinical rotations across different areas, which allow the PAs to work in virtually any specialty. Nurse practitioners are trained in the nursing model, which emphasizes patient centered care, health promotion, and disease prevention, often focusing on a particular patient population like family practice, pediatrics, or gerontology. Both PAs and nurse practitioners are licensed to diagnose, treat, and prescribe, and both work collaboratively with physicians and other healthcare professionals. The main difference is the educational pathway and the approach to patient care. But in practice, both roles are vital to delivering high quality team based healthcare.
I've read about a push to change physician assistant to physician associate. Can you explain why and whether you think that's a good idea?
Yeah, the profession is changing the title from physician assistant to physician associate. The main reason is that the word assistant can be misleading to patients and the public, suggesting a supportive or subordinate role rather than as a fully licensed clinician who can diagnose, treat, and manage patients on their own. Many PAs and professional organizations, including the American Academy of PAs, felt that physician associate better reflects the autonomous, collaborative, and professional role that PAs play on the healthcare team. As for whether it's a good idea, it depends on perspective. The change could improve public understanding of the profession, but it would also involve updating regulations, certifications, and public awareness. Overall, the goal is to make the title more accurate and clear while maintaining the PA identity and professional standards.
Do you see a future where PAs may no longer need to be tethered to a physician?
Physician assistants are licensed to practice medicine in collaboration with physicians. And that collaboration model is at the heart of the profession. While a few states have explored or implemented provisions for more independent practice, research and experience show that team based care is generally in the better interest of the patients, providing multiple layers of expertise and support. PAs are trained to work closely with physicians and other healthcare professionals, which allows for comprehensive, high quality care. So, even as the healthcare landscape evolves, the emphasis remains on collaboration to ensure patient safety, continuity care, and the best possible patient outcomes.
Now, what's involved if a PA who graduates from a school in New York, say they find their dream job in another state? Are they able to go start working there immediately?
Maybe not immediately. Once a PA graduates, they need to obtain licensure in whichever state they wish to work in. Each state has its own licensing requirements, but the process generally involves graduating from an accredited PA program, passing the national certification exam, and applying for the state license with documentation such as transcripts, proof of certification, and background checks. But once licensed, a PA can practice in that state under the same collaborative supervision model that exists in New York. PAs also maintain national certification, which is required for licensure in any state. This process allows PAs to be mobile and to pursue opportunities across the country while ensuring that they meet the specific standards and regulations of the state where they practice.
Artificial intelligence is making its way into various fields of medicine, and while the PA profession is very popular now, I wonder if you see that continuing to be the case 20 years from now. How do you think AI is going to impact the profession?
AI is certainly becoming more integrated into healthcare, helping with tasks like diagnostics, imaging interpretation, and administrative workflows. However, the core of the PA profession, patient interaction, clinical decision making, and compassionate care, can't be replaced by AI. AI may make PAs even more valuable by supporting their work, reducing routine burdens, and allowing them to focus more on direct patient care. I expect the profession to continue growing over the next 10 to 20 years, particularly because the healthcare system will increasingly rely on team-based care to meet patient needs. PAs are trained to adapt across specialties and settings, which positions the profession well for the evolving landscape of medicine.
Well, Dr. Chalupa, I really appreciate you making time for this interview.
It was my pleasure. Thank you for taking your time to include me.
My guest has been Robyn Chalupa, a physician assistant who serves as chair of physician assistant studies at Upstate's College of Health Professions. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Rokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.